Flumazenil is a benzodiazepine antagonist that is used for the complete or partial reversal of the sedative effects caused by benzodiazepines in various clinical settings, such as induced general anesthesia for diagnostic and therapeutic procedures. In this video, let's find out what is Flumazenil? What type of drug is Flumazenil? What is Flumazenil used to treat? Who cannot use Flumazenil? What are the side effects of taking Flumazenil? How does Flumazenil make you feel? How to use Flumazenil? What is Flumazenil? What class of drug is Flumazenil? Flumazenil is a selective GABA receptor antagonist administered via injection, otic insertion, or intranasally. Therapeutically, it acts as both an antagonist and antidote to benzodiazepines through competitive inhibition. It was first characterized in 1981 and was first marketed in 1987 by Hoffmann-La Roche under the trade name Anexate. However, it did not receive FDA approval until December 20, 1991. What is Flumazenil used to treat? For the complete or partial reversal of the sedative effects of benzodiazepines in cases where general anesthesia has been induced and/or maintained with benzodiazepines, and where sedation has been produced with benzodiazepines for diagnostic and therapeutic procedures. Also, management of benzodiazepine overdose as an adjunct for appropriate supportive and symptomatic measures. Who cannot use Flumazenil? Contraindicated in patients with a known hypersensitivity to Flumazenil or benzodiazepines, in patients who have been given a benzodiazepine for control of a life-threatening condition, and in patients who are showing signs of serious cyclic antidepressant overdose. What are the side effects of taking Flumazenil? Weak or shallow breathing, ongoing drowsiness, confusion, agitation, tremors, dizziness, chest pain and severe dizziness, rapid pulse, fast or pounding heartbeats, or a lightheaded feeling, like you might pass out. Pharmacodynamics. Flumazenil antagonizes the CNS effects produced by benzodiazepines, but does not antagonize the central nervous system effects of drugs affecting GABAergic neurons by means other than the benzodiazepine receptor, including ethanol, barbiturates, or general anesthetics, and does not reverse the effects of opioids. How does Flumazenil work? Flumazenil, an imidazobenzodiazepine derivative, is a benzodiazepine antagonist. It competitively inhibits the benzodiazepine binding site on the GABA/benzodiazepine receptor complex. Flumazenil is a weak partial agonist in some animal models of activity, but has little or no agonist activity in man. Half-life. Initial distribution half-life is 4 to 11 minutes and the terminal half-life is 40 to 80 minutes. Prolongation of the half-life to 1.3 hours in patients with moderate hepatic impairment and 2.4 hours in severely impaired patients. Compared to adults, the elimination half-life in pediatric patients was more variable, averaging 40 minutes, range 20 to 75 minutes. How to use Flumazenil? Reversal of conscious sedation and general anesthesia. 0.2 mg 4/15 seconds. If after 45 seconds no response, administer 0.2 mg again over 1 minute, may repeat at 1 minute intervals, not to exceed 4 doses, 1 mg. If resedation occurs, may repeat doses at 20-minute intervals, not to exceed 1 mg per dose or 3 mg per hour benzodiazepine overdose. 0.2 mg 4/15 to 30 seconds. If no response after 30 seconds, administer 0.3 mg over 30 seconds 1 minute later. If no response, repeat dose of 0.5 mg 4/30 seconds at 1 minute intervals to max cumulative dose of 3 mg per hour. In the event of resedation, may repeat dose at 20-minute intervals if needed, not to exceed 1 mg administered as 0.5 mg per minute, administered at any one time and no more than 3 mg per hour. Rarely patient may require titration up to total dose 5 mg. If no response after 5 minutes, sedation unlikely to be secondary to benzodiazepine. Are there specific concerns about Flumazenil and pregnancy? US FDA Pregnancy Category C, Animal reproduction studies have shown an adverse effect on the fetus, and there are no adequate and well-controlled studies in humans. But potential benefits may warrant use of the drug in pregnant women, despite potential risk. That's all the information about Flumazenil we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video, to update more health information.